Good afternoon, everybody. It is Dr. Kachikian from the Black Hills Regional Eye Institute. Just got another cataract case. We'll make our side port. We'll see what goes on here. It's been a bit since I've seen this video. It's a little bit of lidocaine, and then we'll get our viscoelastic in. Get a good fluid wiggle to get those bubbles out. Try to get the bubbles out because I don't like them when I'm doing the capsulorhexis. Little corneal marker to guide the capsulorhexis size, and then we'll make our 2.4 millimeter incision. Keep those spikes up, and then I usually just aim straight in or kind of bevel slightly up to make a nice square incision. And that one looks good. Let's see if we try and get this bubble out of here. That it looks like, yeah, it's going to annoy me, I can tell. So use a Utrata and a 0.12 to make our capsulorhexis. And I will use that mark I made as a guide and follow the edge of the pupil for keep it as circular as possible. It's a pretty even dilation, so if I can stay even from the pupil for 360 degrees, that should be a nice round capsulorhexis and centered as well. Looks a little on the smaller side, but it should be perfect. A little BSS, good fluid wave. It's the hydrodissection, I always like to hydrodelineate too. I'll free up the nucleus from the epinucleus for easier removal. Good rotation, and we'll put a little aliquoted viscoelastic in there just for additional protection. And usually go in, check the flow. There you go, that's good flow. Quadrant removal, get out any viscoelastic distance away and any anterior cortical or epinuclear material, and then we'll sculpt. And then we'll kind of break this up. It's not a very deep trench. Let's see. All right, good. We got our crack. And okay, here it looks like I'm trying to take out just a hemi-nucleus. So I usually will use this technique when the lens does not rotate. I try and get out a whole hemi-nucleus. And it actually works pretty well. If you can get a good crack, and then you can bring up one side and then the other, it's good. It's a good strategy for a loose bag. You could pop the lens out of the bag in those cases, but if you don't want to do that, bringing up each hemi-nucleus is also a good strategy to prevent kind of traumatizing further any zonular weakness. So there we go. We've got both of those hemi-nuclei out of there, and then we will get our epinucleus. The other thing to know about this strategy is it helps to really have good hydrodelineation, because you want to be able to easily get out the nuclear material. You want that hemi-nucleus to come out of the bag, and it comes out of the bag if there's good hydrodelineation. If there's only hydrodissection and it's stuck to epinucleus and cortex, sometimes it tends not to come out want to come out right away. All right, so now we've got that whole lens out of there. Now we'll do some IA. I do like using this technique. I just feel like it's not as organized as kind of my traditional Stop and Chop, because I don't know, you can't tell how much of the hemi-nucleus is going to come out, and you do still want to break it up as it comes out of the bag. The other thing I've been kind of looking at is how exactly I do my cortex removal. It looks like I usually go around clockwise until a point where I feel like, I don't know, I just decide, okay, now I'm going to go the other way. Maybe that's another way of saying I don't have an exact kind of strategy, but I'll usually start clockwise and get big sheets out until I get to a point, I think, where I feel like I don't have a good angle to get the rest, and so then I'll switch back the other direction for cortex removal. Now I'll power wash the capsule. This is really good for getting things out that are stuck in the fornix. You'd be surprised how much cortical material is hiding in the fornix under the iris there sometimes, so it's always good to spray the capsular bag and the capsular fornix, and then we'll do our interior polishing. get out some of those residual cells, reduce the inflammation, that sort of thing. And it's a nice round Capsulorhexis. It looks pretty well centered, so that's good. So we've got that capsule polished, and we'll get the lens in the bag. There we go. And then usually I use a Sinski to help it unfold, get it in the position that I like to have it in. It also speeds up the unfolding process. I've been noticing that when the operating room is cold, the unfolding is slow. When the operating room is warm, then the unfolding is rather quick. And I know that's obvious, but then it makes me think about people who do versus do not use a second instrument to help with lens positioning. And our ORs traditionally have been pretty cold, and so it's always slow for the lens to unfold, and so that's why I use that second instrument, because it helps get those haptics where we want them to make sure that the lens is going to be centered properly. We'll get rid of this viscoelastic, usually sweep the angle to make sure that there are no nuclear pieces there and that all the visco or pro-visc is out of the angle. And then we'll use some BSS and hydrate. And also, I use the BSS again in the angle to make sure that there are no pieces of nuclear chips or no remaining viscoelastic. And every once in a while, you'll see a little visco pop out of the angle. And then even more rarely, you will see a little piece of nucleus either come out of this side port or come out of the angle. All right, so get that lens centered nicely. Looks good. We'll seal up our incisions and check our incisions, and that's the case. Hope you folks enjoyed this one, and we'll see you next time. Let's get that pressure just the way we want it. All right, there we go. Perfect.